this was, I forget, it was it's a man. I'm only saying that because it's relevant to the diagnosis. And you can see that the patient had, it was an ED case. It was done for renal stone evaluation, which patient had. And of course, patient had this incidental mass, right? And this incidental mass, you can see, has a fatty kind of component. So we recommended that the patient has MR, of course, for evaluation. So just to confirm what we already know from the, from CT, you can see that there's gross fat, right? And again, acute finding, physics finding is that you can see the ring of the outer phase surrounding this rind of fat because that's gross fat, right? So that's pretty acute. We also see that you can see that the gross fat is kind of brighter on in phase, right? Just like the subcutaneous fat. And when we apply frequency selective fat suppression, you can see the entire thing drops. So then, this is the arterial phase, and you can see the mass is fairly hypervascular. I'll just bring in the second phase here. This is the second phase, you can see. And this is hepatobiliary phase.
Before you give the diagnosis, Anu is sending in some things I've never heard of, so we want to give her a chance to.
Okay.
Moment in the light. She is asking if it could be a heart, which I just Googled, hepatic adrenal rest tumor.
They tend to be the ones that I've seen are much smaller. They're like little rests.
Okay.
But to be honestly, I don't know enough to say that it can't possibly be that.
I was excited because it can have fat in it. It's located it's in the similar location and it's hypervascular. So when I looked at this, I was like, that's it. But
well,
never mind, let's continue. I got excited.
Okay, but if I told you I have a mass which has mildly restricted diffusion, enhances on arterial phase, enhances less than the liver on the portal venous phase, has fat, doesn't get.
It sounds like HCC. Yeah.
It sounds like HCC, right?
Yeah.
So,
wait. We do
that's
have
a differential for HCC as well. Like
we do have some other guesses. So AML, which I was thinking when you said fatty, like has bulk fat, enhancing and washing out, and then Gitanjali says adenoma.
Right. So the main differential here, like the most common, like all those things are correct, but the most common differential would be HCC. Adenoma, now this is a man, right? So a man, the type of adenoma that men have is not the type that tends to have fat. So that's less likely, but it still could be.
The liver looks abnormal too.
Huh?
The liver looks abnormal too.
No, it was actually, it was all right.
Is it?
But the patient, the cirrhosis may be in the parent on the imaging, or a patient can have hepatitis B. Anyway, so all those are correct great things, and obviously in this case we would need a biopsy, and we did, and this was the answer. So this was an angiomyolipoma, but with it was hepatic epithelioid angiomyolipoma, which is a rare mesenchymal neoplasm. It is men are less likely to get them, but this was a man, and that's it. So they may or may not have fat, but this one did. They tend to be hypervascular. This one was, and then either can have washout or just kind of like be fading. So there's nothing specific. These things need biopsy. So this was a cute little.
And this patient did not have tuberous sclerosis or AMLs in in the kidneys and stuff like that.
No, this was fully incidental. There's nothing anywhere else. They biopsied it, and the patient is just living his merry life.
Nellie, do you remember one of our first case conferences? I presented an epithelioid AML, and Matt Davenport was on, and we talked about this.
For the kidney?
Yeah.
Yeah.
In my case, what I learned was, it was a patient with tuberous sclerosis, multiple other AMLs, but my lesion was a large enhancing lesion invading into the IVC. And so we didn't know if it was an RCC invading the IVC, and then it turned out to be an epithelioid AML. So they're much more common in patients with tuberous sclerosis, and they can mimic, especially in the kidney, they can mimic an RCC. They don't necessarily have fat. And they're kind of in this benign to malignant spectrum.
But this is a hemangioepithelioma, right?
No, this is AML with epithelioid features.
Can you go back to your slide? Got it, okay.
This is the same thing as what I showed in the kidney.
A liver version.
You can also get it in the liver, especially in patients with TS, but this seems like a spontaneous one. And this is still in the family of picomas, which includes AMLs, epithelioid AMLs, and other sugar tumors.
Why do you call it sugar?
They're called sugar tumors because they have like a lot of glucose in the cells. Like if you Google picomas, they used to be called sugar tumors. They're more common in the lungs, and but they're in the spectrum of like things that people with tuberous sclerosis can get. So like if they have LAM and then they have like a tumor somewhere else, and not even necessarily in the kidney, it could be anywhere else. It could be a picoma or a sugar tumor.
Very cool case. Very cool case, Victoria.
Yeah. Right.